I'm Dr. Nicola Buxton. I'm a GP in Clapham and I'm also the academic lead for the final year GP placement based from here at St George's. We would love to offer you the opportunity to come and teach with us on this placement by hosting students in practice. This placement is a final year placement as the students prepare for their final year exams and to move into their F1 roles in their future career. It's a placement that the students consistently rate extremely highly, and they find it a fantastic opportunity to consolidate their knowledge and they practice their clinical skills and to really gain a great understanding by being fully immersed in the practice. The students would spend between 4 and 5 weeks with you for the majority of sessions with yourself and your team in your practice. During that time, we hope the students will all have a chance to experience working with the multidisciplinary team and meeting all the members of your practice team, to be engaged in practice meetings and the work of the practice, but also very importantly at this stage in their training to have the chance to do supported independent consulting for 2 or 3 sessions per week. As a spoke tutor, which is a tutor hosting students in your practice, that would be the main role, would be to supervise the students there. There's also some assessment involved, and that's supporting the student to write a referral letter, to do a mini clinical evaluation exercise, a case-based discussion, and to do some clinical outcome records, just reviewing the experiences and the clinical placement opportunities that they've had, and the students can then discuss those with you. These students also go for hub tutorials once a week. So in each area where your practice is based, there's a practice that will host as a hub tutor, and there are opportunities to become a hub tutor as well. In addition to hosting a student in practice, these hub tutors then have the other students from the locality once per week for a tutorial to help the students to consolidate and build on their knowledge. They are marking the students' reflective writing, and also at the end of the placement arrange a small clinical case-based assessment, which is a chance for the students to practice a formative way of examining, interviewing and presenting patients, which is very similar to the formative assessment that's used in their final year exams. Students really enjoy this. The clinical staff involved in delivering it usually enjoy this, and it's a very worthwhile and formative experience. What do we provide you with? We provide you with tutor training, a handbook and all the resources. The placements are well remunerated, and we want to make sure you feel well supported. There's direct contact to a final year administrator, GP education manager, and to myself as the lead, and we're available to speak to you with any challenges, queries or difficulties. There's a wider community of tutors from St George's, and there are opportunities to participate in Clinical Teachers Day and other teaching and training opportunities, including other courses and parts of the curriculum that you can become involved in teaching on. So this is a rewarding placement to teach on. It consistently has extremely high ratings from the student. They report that they feel more prepared for their F1 posts, and they're more likely to consider general practice as a career. Also, I think clinically it's really important that whichever specialty they go into, we know that having spent time with you, they'll have a much greater understanding of the role of the GP in primary care in that patient's journey, every patient they see, and they will understand the holistic and personalised care that's offered in general practice and how that happens before and after any contact they may have with the patients in hospital, either in the junior stages of their future training or in the longer term in their career. I think this is a key part of ensuring that as a profession that we work together in a multi-professional and multidisciplinary team to ensure the best possible care for the patient, and them having a greater understanding of primary care is crucial to that. So thank you for your interest. Please do contact us if you've got any questions or queries. We're very happy to answer. We can put you in touch with existing tutors who can talk about their experience and show you some of the feedback from students about their experience of this placement. Contact details are below. Do get in touch with us. We're very happy to have individual meetings with you to answer any queries and to provide you with further information if you'd like to consider teaching.